Hi, my name is Sharmila. I am doing UG course BCA in St. Joseph College of Art and Science for Women. Today I am presenting the topic of teen suicide. Explanation about teen suicide. What is teen suicide? Suicide is when teen causes his or her own death on a purpose. Before trying to take their own life, children may have a thought of wanting to die, known as suicidal ideation. He or she may also have a suicidal behavior when a teen is focused on doing things that causes his or her own death. Suicide is the third leading cause of death in young people ages 15 to 24. CDC reports that boys are 4 times more likely to die from suicide than girls. Girls are more likely try to commit suicide than boys. Guns are used in more than half of all youth suicide. Teen suicide statistic. Suicide is the second leading cause of death of ages 15 to 24. 63% of teen suicide is male and 20% of teen suicide is female. It increases access to guns. Unfortunately, statistics shows that rates of teenagers are on the rise. Each day there are an average of attempts by young people teen suicide. Reason why. While there are many factors that can influence a person's decision to commit suicide, and they are mental illness, substance use, chronic pain or illness, feel like burden to others, social isolation, cry for help, accidental suicide, and mental illness. Mental illness are like depression and stress. The most common severe 14 suicide is depression. Depression can make people feel great emotion, pain, and loss of hope, making them unable to see another way of relieve pain and other than ending their own life. And substance use. Substance use are like drugs and alcohol. They can contribute to other reason. People commit suicide by alcohol and drinks such as loss of jobs, relationship and family problems. And loss or fear of loss. A person may decide to take their own life while facing a loss or fear of loss like jobless, ending of family, relationship, shame, humiliation or social status. And chronic pain and illness. Chronic pain and illness. If a person has a chronic pain or illness with no hope of cure from suffering, suicide may seem like no way to regain dignity and control their own life and feel like burden to others. People often see themselves as a burden to others or feel worthless due to the overwhelming emotional burden they are carrying within. And social isolation. A person can become socially isolated for many reasons like losing friends, separation, divorce, physical, mental illness, and retirements. And cry for help. Sometimes people attempt suicide not so much because they really want to die, but they simply don't know how to get help. And accidental suicide. Sometimes situations that appear to be suicide may actually be an accidental death. It includes unintentional overdose and fire. And method of teen suicide. How the teens are making suicide, like suicide bombing, poisoning, hanging, firearm, jumping, use of medicines like tablets, substance use like alcohol and drugs, electric shock, cutting of wrist and veins. The most common method of suicide is the age group, like firearm 49%, hanging 38%, poisoning 7%. And awareness of teen suicide. September month is also known as National Suicide Prevention Awareness Month, which helps to promote resources and the awareness around the issue of suicide prevention. How to talk about suicide without increasing the risk of suicide. Suicide awareness protective effect to raise awareness around the suicidal behavior by bringing attention to suicide statistically, socially, and encouraging positive dialogues and engagement as a means to prevent suicide. And causes of teen suicide. Teenagers' years are a stressful time. They are filled with major changes. It includes body changes, changes in thoughts, and changes in feelings. Strong feeling of stress, confusion, fear, doubt may affect a teen problem solving and decision making. He or she may also feel too pressure to succeed. For some teens, normal combined with other events such as changes in the family such as divorce, siblings moves out or moving to a new town, changes in friendship, problem in school, family conflicts, domestic violence, academic failure, unfulfilled romantic ideals. This problem may seem too hard or embarrassing to overcome for some. Teen suicide may seem like and warning sign of teen suicide. Suicide among teen often happen a stressful life event, such as problem at school, breakup with a boyfriend or a girlfriend, the death of the loved one, divorce, or a major family conflicts. The teen who are thinking about suicide might talk about suicide or death in general, giving hints that they might not be around you anymore. Talk about feeling hopeless and feeling guilty, pull away from the family and friends, write song, poem or a letter about death, separation in one loss, start giving away treasured possession to siblings to friends, lose the desires to take and part in favorite things, have a trouble in concentrating and clearing things, engage in risk-taking behavior, lose interest in school and sports. If you think that your teen has any of the warning sign for suicide, don't ignore them. Trust your instincts and either try to get more information or seek an additional help. Risk and factor of teen suicide. Suicide is a rarely caused by single circumstance or events. Instead of range of factors at the individual relationship, communication, social events can increase risk. Their risk factors all situations are a problem that increase the possibility that a person will attempt suicide. In addition to undertreated depression, other suicide risk factors includes like previous suicide attempts or recent loss such as loved ones, our relatives, jobs, parent separation, divorce, being bullied at on every time, depressions or bipolar disorder, mood disorder, sexual assaults during drugs and alcohol, unknown anxiety, child abuse. Previous suicide attempts or recent loss such as loved ones, job, relatives, parental separation, divorce, being bullied at school or everywhere, depression order, bipolar disorder, mood disorder, sexual assaults, drugs and alcohol, chronic anxiety, child abuse. Prevention of teen suicide that make it even more and more important for parents and everyone else, that is regularly around teenage to understand how to try to prevent suicide, like address depression or anxiety, pay attention, share your feelings, discourage isolation, encourage and physical activity, supports the treatments and plans, safety store firearms, alcohol and medication. You should also make sure that your kids know that they can ask for help if they ever thinking about hurting themselves, including calling the National Suicide Prevention Lifeline, calling the doctor, calling 911. At last, conclusion of teen suicide. We can conclude that suicide is a subject that is not talked about often. Suicide does only affect adults, but it affects teenagers as well. A teenager would commit suicide due to something that has occurred in his or her life because of them going through a series of emotion. Suicide can be prevented through education and public. Research has shown that medication and therapy to be effective suicide prevention. There are many struggles in life that continue to grow, but many people find that they have a run out of coping mechanism that can help them to get through the situation. One little smart act can send a person over the edge to where they about to suicide or even commit suicide.